Yay Media Group.
I think it's important to get joy from the little things that are good for you. Like learn how to enjoy exercise. Find an exercise that you get pleasure from, and then you'll be more compliant. So do the things with your family and your friends that bring you joy. When you screw up, forgive yourself and move on. Don't beat yourself up. I'm a big believer in looking forward and not I tell people, just give yourself some grace, give yourself some forgiveness, and just move on. And then if in regards to aging with the things like skincare, I love, sunscreens are important. Find a routine that gives you the results. Because like I said, that lady who came in and she said, I'm happy when I look in the mirror now. That made my day. That's what I want. So you want to look in the mirror and you want to feel like you've got a glow, that your skin looks hydrated, and don't wait until you're 55 to do something. The earlier you start, the less aggressive we have to be.
A quick note before we dive into today's podcast. If you like what you hear, I would love for you to subscribe to Fueled Wellness and Nutrition, wherever you download your podcast. It would also be incredible if you take a minute to rate and review this podcast. Those things do matter and they really help us. I'm Molly Kimball. Welcome to Fueled, a wellness and nutrition podcast. I'm a registered dietitian and nutrition journalist with a passion to help people live their strongest, healthiest life possible. In my weekly TV segments and columns, there's a limited amount of time and space to cover everything, but there's so much more to share. This podcast is my opportunity to dive deeper into the topics you want to know about. Welcome back to Fueled Wellness and Nutrition for the second part of my conversation with Dr. Mary Lupo. So in our previous episode, we covered the fundamentals, her streamlined routine, her personal streamlined routine. What's the deal with hydrating our skin versus occlusion? How do these work together? Sunscreen, how to interpret product labels, and retinoids, and the fact that, retinoids are really not the main driver of aging skin for most people over 50. In this episode, we're getting into the stuff that people are texting their friends about. So what's the deal with hormones and our skin? What are some of the testosterone trade-offs? And GLP-1s, what's happening with our facial changes and Ozempic face there? Procedures and devices, we'll be talking about these, and also how Dr. Lupo decides what is truly worth your time and your money. Do we want to go next to, let's touch on it, and then we can spend more time on some of the others, but hormones and skin.
So I am one of these people that, very recently, basically the government came out and said, oops, we were wrong, or the medicine was wrong 20 years ago when we told people that hormonal replacement therapy was bad for women. Let me tell you something. I think every woman who's, over 60 who wasn't given hormonal replacement therapy because their doctor told them that it was bad for them, they should be mad. I know that sounds a little harsh, but I think they should be mad because they were given extraordinarily inaccurate and bad advice that I think harmed them. The data is pretty clear that HRT is good for, you ready for the list? Okay. Osteoporosis, cognitive, prevention of dementia and cognitive decline, overall feeling of well-being, skin hydration, energy. I mean, the list goes, hair not falling out. It goes on and on and on, not to mention the temporary hot flashes and things like that. But that goes away.
Right.
But the damage to the cardiovascular system, which is real, you're actually increasing your risk of heart attack if you're not on HRT. And I just think it's atrocious. The only thing that, do you have an estrogen receptor positive breast cancer? Even ovarian cancer is decreased with HRT. So I'm a big believer that HRT, it was really a travesty that women were given such bad information. So the number one thing you can do as a woman to be proactive about your bone and muscle health is to get on HRT and to exercise. That's critical. It's you do the exercise and you make your doctor put you on the HRT.
Are you able to tell a difference in skin?
Absolutely.
What does it look like when someone is not? Or what's the difference?
They're terribly wrinkled.
Okay.
They're terribly dehydrated, and they have an excessive amount of sagging. And the women who are on HRT act and look visibly younger. And wait, there's one other one. What's another reason for otherwise healthy elderly women to die? Sepsis from urinary tract infection. And the number one reason for urinary tract infections being so common in elderly women is the atrophy in the genitourinary system as a result of not having the estrogen.
Wow.
And you have to be on progesterone if you still have a uterus. But if you've for whatever reason, had a hysterectomy and or had your ovaries removed, then you only need the estrogen. And estrogen is crucial. And there are estrogen receptors in your scalp, in your face, in your breasts, and all over. But that's where they're in highest concentration. So the next question people ask is, well, what about topical estrogen? If you're on HRT systemically, there are so many other things that I'm excited about for you to be on for your skin that I don't think there's any reason for you to be on topical estrogen. The only thing that the studies have shown, and it's real, is an improvement in the hydration of the skin. So
with topical estrogen.
But so if you're not on anything, at least be on topical estrogen on your face. I think you can make a strong argument for that.
I think this is one of those things that some women know about and they think everybody knows about it. But I've been asking around, and a lot of women had no idea that people were putting like topical estrogen on their face.
This is not new.
I know
This has been going on for 30 years.
And so then I started looking and I'm like, the research has been going on, not even people just using it, but the published data on this is, and I thought, then I was like, am I the only one who didn't know this? So I started asking people who are well-versed in medicine, physicians themselves. And some said, no, they didn't know it. And I thought, okay, it's not just me. So walk us through. So if someone is taking, when you say HRT systemically, tell us what that means, kind of what the options are someone would have.
So systemically means it's either by patch, topically, injection, pellets, something where it's getting into your system. You do not want to take estrogen orally and have it metabolized by the liver. That can be, in fact, that's probably what started some of the misconceptions about some of the problems you have with oral estrogen. So you don't want to take oral estrogen. You want it to be a patch. If you have
a patch or a cream or the pellets.
Exactly. Okay. That's what you want. Now, the next question, the big one that we get is, do I get on testosterone?
Does that affect skin?
Estrogen?
Testosterone.
Oh, testosterone has a big effect on the skin.
In a positive
and almost
way?
All of it is negative.
Oh, really?
Okay. So what are the pluses of testosterone? Pluses are increased muscle mass, easier to lose weight, increased energy, increased sex drive. Negatives are your hair will thin 100% of the time. Your skin will get much oilier, for better or for worse. And in some women, it will trigger acne. And then thirdly, they will get hair on their face.
What about aging or wrinkles or thinning?
I think estrogen is more important than testosterone.
To prevent. But testosterone doesn't cause that. But
testosterone doesn't cause the wrinkles.
But it can leave you hairy and oily.
Right. Well, think about the masculinization.
Right.
Think of what excess testosterone does in men. Their hair thins, they have a nice rugged beard, and men are more, we're talking about the teenage years. Boys have much worse acne than girls. And it's all because of the testosterone.
And what would someone see if they're going to use the estrogen cream on their skin? You said hydration. So what would that look like?
So if I were using just an estrogen cream, I'd use it where where it's important to use it, which is in the genitourinary tract. And I would definitely put a little on my face then if I weren't on it with a patch,
Okay,
or a pellet or something like that.
And so it is hydrating. So fine lines, that type of a change, someone may see a little improvement on.
So, and also a certain amount of luminosity to your skin. So, and you want to be on the estradiol, not the estrol or whatever it is. It's the estradiol you want to be on.
Okay. So note that, y'all. If you're using the estrogen cream and you are like me and you didn't know, go ahead and just put it on your face with that topical. You've got it. So you're welcome there. And if you are not in the space yet where you're taking or considering hormone replacement therapy, then just tuck that away for later.
So one of the things I tell my patients before they do HRT and the issue of testosterone comes up, because I have a skewed opinion of testosterone because I have to treat the problems. Women come to me bemoaning their hair loss.
And hairy chins.
But remember, menopause without HRT with estrogen, your hair will also thin. So it's a disaster. So if I have to treat the hair thinning, they have to have laser hair removal for their whiskers. Just like, what else is going to go wrong? And then they will get breakouts. So these are the things I think are very important for people to consider. So a lot of people ask me directly, and I'm very transparent. I've been on HRT now for 20 years. Did you see my birthday cake post on Instagram?
If y'all don't follow Dr. Lupo, follow her on Instagram. It's educational and entertaining.
So I gave myself a birthday party when I was 20 years on HRT, and that was in November of 2005 that I got on HRT. And it was after I did an endometrial ablation. Best thing I ever did, because perimenopause for me, and I think I was just thrown into perimenopause because it was, did you hear the date? 2005? It was Katrina. So, I went through Katrina. I was displaced from my home and my business for 4 months. I was alone with my 13-year-old daughter, who was going through the stage of, she really didn't like her mother, okay? My husband wasn't there with me in Colorado. He was here in New Orleans helping rebuild the neighborhood. And so it was a very difficult time. And I was, I had horrifically erratic bleeding. And then I was depressed. Now, was I depressed because of my hormonal fluctuation? Was I depressed because of Katrina? And Molly, I have never been depressed before in my entire life. And so I was not used to being depressed. I'm a very positive person. And I was miserable. And the ablation completely eradicated the bleeding, and I was immediately put on the HRT.
Okay.
And it was life-changing. But I never considered getting on testosterone, and I will never get on testosterone because I'm too vain about my hair. I'm too vain about the quality of my skin, because your pores definitely get bigger when you're on testosterone.
I remember asking you about it years ago, and you said, look, I'm basically that you were so
assertive.
That may have been the word that you used. And you said, I don't think it would be good for me or anybody else if I was on testosterone.
That's right.
What's next?
It worries me because I'm so
assertive
and so strong. And I'm scared if I get testosterone. So that's my testosterone take.
So it's a lot to consider, a lot to keep in mind. And again, bringing this to your physicians and talking with them about it. So knowing that estrogen plays this key role in our skin, our hair, our bone health, even how our brains are aging, and that systemic hormone therapy affects all of that. And then considering something like topical estrogen, which is mainly going to help with hydration and skin quality. And if you are looking at something like testosterone, knowing that while it may have some benefit, it also is going to come with some real trade-offs for your skin, for your hair. So next we could talk procedures, but I think let's talk very quickly, since we're kind of on the same space, GLP-1s.
Oh, I love that.
The Ozempic face, what are we seeing, and what do people need to be aware of, and what do they need to think through?
So I feel very strongly about that we're not giving people enough good information before they get on this drug. So these are my pearls. Before you get on a GLP-1, for at least 6 weeks before, you need to start weight training. And you need to look at your diet, preferably with a nutritionist, and look at your protein intake. Because if you don't build the muscle and you're not on enough protein, you're going to lose muscle mass. That's number one. Number two, be prepared that the dietary changes, because, fats are good for things, etc. Almost everybody who's on a GLP-1 they're going to lose hair too, which is another reason why I'm not on a GLP-1. Okay.
You don't need to be. Come on. It's vanity.
Who doesn't want to lose 5 pounds? I mean, really, Molly.
I call it the vanity pounds.
Okay.
And we'll keep going, and then I'll share a little.
So you're going to lose your hair, and you're going to lose your facial fat a lot.
Is it a higher proportion of facial fat lost, say, pound for pound, when someone's losing that
I think so.
whole body weight? It seems like it's got to be.
I think so. And I think it has something to do with the age.
Yeah.
I think maybe the young ones don't lose it in their facial fat as much as the older patients do.
Because it seems like you see this person losing 20 pounds, but that same person losing 20 pounds with something, we'll say Ozempic categorically for GLP-1s, losing that 20 pounds with Ozempic, their face looks different than if likely it would if they just take it.
And maybe it's the speed.
Yeah.
But this is the thing that we're just now realizing and talking about. And maybe a lot of people have never heard of this. We like biostimulatory fillers sometimes to replace
like
that volume. Sculptra and Radiesse are the two big ones. Well, guess what? Those biostimulation by those fillers work by a process of an inflammatory response to the filler to stimulate collagen production. Well, the GLP-1s are anti-inflammatory, that's a good thing in some ways, so people's arthritis might get better. So is their arthritis getting better because their weight is less, or is it because there's an anti-inflammatory benefit?
Right.
We all know that psoriasis patients, they're profoundly inflammatory state. And their joints are involved. So when you get on these drugs, there's sort of like, it just goes to speak that we're not in a vacuum.
Right.
It's a very holistic thing.
And nothing is without a side effect. You may have a whole host of benefits here, yet we still have a side effect here.
So they're not going to respond as well to the biostimulatory fillers. So you're probably going to have to go with a hyaluronic acid filler. And then you get into
what are some of the names of those?
So that would be the Juvederm, the RHA, the Versa, there's Evolysse, there's Restylane. There's a whole bunch of HA fillers out there that all have their different little signatures and proprietary ways that they are manufactured that make them a little different, if you will. So you almost have to go with that. But this is the problem, at least in my mind. Most of the people, they lose that temporal fat pad and they lose that preauricular fat pad.
And so you're saying here around the temples and then around the jawline?
Okay. And if you use an HA there, you got to be careful because that's when people get the puffy look.
Right. Because your whole thing too is, when people think filler, you think about filler that you've seen, but some of the things that you're talking about, like Sculptra, is a way to add volume that you don't actually even see. It's a way.
So what Sculptra and the biostimulatory hyperblended Radiesse does is it increases your dermal volume. Now, you do know that there is a filler that's biostimulatory to fat. It's called Renuva. And what Renuva is when people donate their bodies and they harvest things, corneas and all, they harvest fat. And this company, MTV, I think, it's not MTV. It's got 3 letters to the name. What they do is they take the fat and they treat it to remove all viruses, all proteins, etc. And they denature the fat. That all that's left is that sort of honeycomb matrix of proteins that make up where the fat deposited in, like a honeycomb.
Right, right.
And we're injecting that.
Wow. That's crazy.
Mm-hmm. No.
Wild.
So it's renewable. But again, it's biostimulatory, but at least it's biostimulatory to fat.
Yeah.
So it's an interesting option. It's substantially more expensive than the other stuff because it's very elaborate and sophisticated, sterile conditions. And it's like a tissue donation more than it is a filler, to be honest with you.
So if someone is on GLP-1, the things that we said, strength train, get that protein in. I think when we look at what the physician or provider's perceptions are, they see muscle wasting and they see that loss. That when you ask the people who are on it, they don't see it.
They don't see it.
And we've done these like large scale surveys, and it's been really interesting that I think we did one, it was 70 people. None of them said they had lost any muscle mass. They all said, no, I have not.
Well, are they doing the testing? Because, you can get tested.
No, this was more their own perception. But we know you don't have 70 people on a GLP-1 and they haven't lost muscle. When we asked the providers about a group of, all said, every single one of them is losing muscle mass. So there's a disconnect. A disconnect. And I think people are so happy to be thinner that they don't recognize that a lot of that is also muscle loss. So get your protein in, add your strength training. And if you are on GLP-1 and you're getting that quote Ozempic face and you think, let me do some filler, be really open with your dermatologist.
Let us know. It's important for us to know.
Because it's going to dictate what is the type of filler. So on that note, one of the questions that I had from one of our listeners is, well, fillers versus Botox. I think if you can just give us a quick snippet of that. I think most people know, but just...
So when someone wants to look younger, I typically tell them there's my 4 pillars. Number 1 is good skincare that we got into. We probably need to talk a little bit about ReQ because that fits into biostimulation that we need to talk about. The second is the neuromodulators. That means the Botox family of injections. They are really to have a direct effect on the muscle. And the key for optimal results, in my opinion, is not to paralyze the muscle, but to strengthen the muscle in some place by injecting the toxin in another place. And you get compensation to, for example, my number 1 uses to use the Botox family of medicines is to lift the brow. And so what I do is I specifically target the brow depressors, which are the muscles that pull the brow down. And when you inject and relax those, the brow will drift up, right? So that's number 1. Then another place I love to use it is in the corner of the mouth where the mouth is pulled down and in the neck, especially the upper lip. There's a muscle called the platysma that goes from your clavicle and attaches above your jawline, and it does one thing, and we don't like it. It pulls your face down. So we want to neutralize that pull down. So in general, most people associate the neuromodulators or toxins, as they're called, for mimetic or wrinkles caused by movement of the muscle, the crow's feet, the scrunching in, the frown line. But really the better use is to modulate the movement and improve the resting expression of the patient.
Versus freezing that expression.
Exactly. Then the third thing are the fillers, and that would include what I call space-occupying fillers, which are primarily your HA fillers and your biostimulatory fillers. And I'm doing an entire lecture in Dallas at the Dallas Cosmetic Forum in March of this year. And my topic is biostimulatory versus regular filler. How do I choose? And basically, I talk about the facial shape. And what am I trying to do? Because to me, just as the toxins are primarily used by me to modulate the positioning of the brow, the positioning of the corner of the mouth, I use the fillers to improve the proportion of the face and the shape of the face. Because for a woman, you want the widest point to be the eyes. As we get older, the widest point becomes our jowl area, and we get heavy here, the lower face. That's not what we want. Youthfulness is associated with the female to have a wider lateral cheekbone. Probably the number one mistake I see in unsophisticated injectors is when they do cheek filler, they do it too medially. And they poof people
Meaning
up.
too close to your nose.
Too close to the nose. It makes the nose look wider. It makes the cheek look heavier. When they smile, it projects forward. They look like Howdy
It looks
Doody.
like you had filler.
And it looks like you had bad filler.
Yeah.
Okay?
Yeah.
And so that's the number one mistake. I find that people who are just injecting things and they really don't have a plan.
Right.
Because it's optimal to inject filler laterally. And then the fourth pillar of my non-surgical rejuvenation is the big bucket of devices. And so when you're talking about devices, you may be talking about something as low level as microdermabrasion, Intellitone low-level lasers, things like that. You may be talking about vascular lasers that target red, lasers that target pigment. Then you may be talking about resurfacing, and then there's non-ablative resurfacing, where you just heat the skin and you denature the proteins of the skin without evaporating them. And then there's ablative lasers, where we literally evaporate some of the skin level layers of the skin off. And then the big breakthrough in the past, I've been doing it for about 2 years now, is it's called laser coring, where instead of cutting the skin and repositioning it, i.e. a facelift or a blepharoplasty, we are having the laser ablate little channels in the skin, causing tightening to close the channels. And it's a very intriguing, very promising, exciting sort of new thing in aesthetics.
So when someone's talking about I think categorically someone may use the phrase lasers.
That's a big bucket.
Right. It's a big bucket. And so knowing that when I've talked with you about it, there's so many, and it's going to be targeted to what that person's needs are. So what one person's going through, like I get Fraxel in your office, may not be the fit. It may not be the solution someone else needs.
Correct.
Yeah.
So, this is where you got to trust the doctor, but this is the other problem. I had the cutest conversation with one of my doctor patients. She came in and she had gotten a light ultra clear to her face. And she went back to work, and all of the other female physicians went, "Oh my God, what did you do?" And she told them what she did. And one of them went to their dermatologist and said, "Well, I want this." And they go, "Well, I don't have this." And that doctor actually said to her, "Well, I think I went to Lupo, but her waiting room didn't look like much."
So the key is the skin, the products and kind of the daily skincare, the what we could categorically say the Botoxes of that, and then the fillers, which the two different categories, one being kind of the Restylane of, I would say that's maybe, I don't want to say old school because I don't know that it is, but
well, very few people
place.
use Restylane now. I mean, more people use Juvederm, which was the sort of like the second big one after Restylane. More people, I think, use Juvederm these days but they're coming up with new ones that are softer or more flexible, or some are firmer for the jawline. It just depends on what you're doing. So people go, what filler do you have? I go, I have them all.
You have them all. And it's just like what Dr. Lupo was saying. When you're at that party, you're going to look at them, you're going to assess. And for every single person, there's going to be that slightly different formula of what they need. Talking about the emerging therapies, the REQ.
REQ. So I'll tell you my REQ story. So I heard about REQ from Dr. Doris Day, who's a dermatologist up in New York. She's a good friend of mine. She's on Sirius. We've done some talks together. And what's different about REQ is it is not anything that's biostimulatory per se.
And it's a topical. We'll say.
It is a topical. And their active ingredient, the RLX, I think is 201, basically hits the TOR receptors that are similar to the rapamycin for anti-aging. And what it does is it helps with cellular senescence. So why do we age? Okay, so there's inflammation from and oxidative damage from the sun, from pollutants. So that contributes to aging. There's telomere shortening, so we can't replicate things because every time you replicate, you lose a little piece of that telomere. So you got telomere shortening. So you've got all of these things that are in the milieu of things that bad happen and make us older. And then there's the general bucket of cellular senescence, which is almost like it does every cell have a clock and it just winds down. So this particular molecule, what they did was they took fibroblasts from specifically 56-year-old women and they incubated it with this active ingredient, and those 56-year-old fibroblasts behaved like 23-year-old comparable fibroblasts. So the reason we think this is important is if the phone is ringing and you're deaf and you can't hear it, you can't answer it, right? So a senescent cell may not get the message to do what it is you want it to do to look younger. That laser may not get the optimal result if your cell is too old to give the healing response. So what Doris feels like, and I'll tell you my personal REQ story in a second, is that it will make everything you use work better and make every device you use have a better effect because you're optimizing the cellular age so that it is able to respond better, which is a really cool idea. Right. Really cool idea.
I like how you break it down like that too.
So she sends me a bottle of it and I'm looking in the mirror and I go, my skin is looking really good right now.
Before you even started it.
Yeah. Okay. I said, I'm not sure about this. How am I going to really, because like I said, I've got the mad scientist. Right. I got so many products. I said, okay, Doris, I got to use this for my friend and give her some feedback. But my skin looks good. Am I even going to notice if it's better? So I look at my legs, and I have done absolutely nothing to my anterior thigh above my knee. And I look down, I go, that's looking pretty bad. Okay, so I
like crepey when you say that.
Crepey, just texture was awful. I have a 71-year-old leg. Okay, so I said I'm going to use it on this one thigh, and so I took a picture. I said, so I got to, because I'm going to forget what it looks like. It's going to gradually get better, I hope. Right. So I took a picture. I used it twice a day for a month. And some days I only used it once a day because I forget. And then a month later, I go, okay, I looked down. I went, I'm not sure if it's better. So I took an after picture and then I put them side by side. Molly, I'm gonna post it on Instagram. It blew me away. Wow. I could not believe that my leg got that much better. And I'm going, okay, I got to bathe in this stuff, okay? Because I also have I got another leg at 71. And so I'm a believer. Right. Because I saw on me, because like I said, I try everything on myself first. I have to look at and they've got great scientific studies. So I'm very excited about it. And
it's called REQ, like RE-Q.
Right. And we just got it yesterday or 2 days ago in my office because I said, please, when it's finally out, because I got it pre-market. They send me stuff pre-market. So I used it. And I'm going to post on Instagram my thigh. I'm almost embarrassed to have people see how bad my thigh looked. But, it's
You're so unfiltered on your social.
I know.
Is that something that if someone's using the Plated Intense, would you use this also?
So Doris is a huge fan of Plated Skin Science. And so I said, Doris, what are we going to do?
Right.
How are we going to use this? I'm using this. She's very direct with me. She's like, boom. She goes, well, Mary, anything you use will work better with this with it.
Okay.
I went, okay.
So do you think you would use the Re-Q first and then plated over it?
I'm working on that.
Okay.
I got to talk to Doris, but I have been using it for maybe... Because I told him, I said, okay, if I'm going to order it, please send me some more because I used up the one for my leg. Right. Okay. And I go, I do want to use it on my face now. So I only got more maybe 2 weeks ago. So I have added it and I'm using it first.
Okay.
And then putting the plated on top of it. But I am making sure that I let it dry between each step. So what do? I wash my face in the morning when I get up. I brush my teeth first, then I wash my face. And then I put the Re-Q on, and then I go down and have my green smoothie. And then...
Which you can also see Dr. Lupo making on her social.
That's right. I have my ingredients in my social media for my green smoothie. And then I will go downstairs and I'll have my green smoothie and maybe I'll look at the newspaper online. And sometimes, and my husband and I will take a 20-minute walk. And right now we are walking before the sun comes up, just at that where there's light enough to walk, but the sun has not broken the horizon.
So it works with the timing before sunscreen has been applied.
So I don't have to put my sunscreen on. And then I come back, and then I'll do my exercise, whatever that is. And then I'll shower, and then I'll put my plated on.
Okay.
That's how I've been doing it. So I've been separating it. But that's not going to be practical for a lot of people because, they don't have stages of their morning. They've got to do it and then they got to get out the door.
But there is a little bit of time where you're maybe going to put on body lotion or maybe you wash your face and do the Re-Q and then you brush your teeth, you floss, there's
all
other
of
stuff
these products pretty much settle in within a minute or so. And I think if you can just do something else in between.
Another little task in there. Yeah.
I just think that's the way that it's going to be optimal. But
bring your devotionals into the bathroom, whatever, if you're reading, whatever you're going to do. Just
but I'll be lying if I said I've got this completely worked out. I don't, but I'm working on it.
Okay. I may be your guinea pig on that too. I can play around with it some. All right, so I'm going to weigh in here with a quick editorial note, and I am coming back in, adding this separately after my interview with Dr. Lupo. So as we were talking and as some more time passed and she had more experience with the Re-Q and really kind of looking at the science of it and how is best to use it. So as you heard her talking about just earlier, she was using the Re-Q first thing, letting that dry, then putting the plated gold. And I'm going to do my best to paraphrase how she explained it to me. And I got the recorder out, but I got the recorder out kind of too late to catch this part that I'm going to share with y'all. But a couple of reasons why. One, the price point. They're pricey products. And so instead of using both products twice a day, AM and PM, using one in the morning, the Plated Intense Serum, and using one in the evening, the Re-Q. And they both work in very different ways and they're both effective in very different ways. And so her thought on this, her approach on this is when you have two different products that are very, very potent, but in very different ways, and also with the price point that comes with them, instead of combining them and potentially losing some of that effectiveness, let them each stand on their own and have that maximum impact. So what she is recommending, what she's doing for herself and what she's recommending for someone who's using both of these products is to use the Re-Q at night. So after you wash your face, dry it well, the first thing that's going to go on after that is the Re-Q. Do your other stuff to kind of get ready for bed, let that dry as much as possible, and then go ahead and put on your moisturizer, whatever is going to be that occlusion barrier moisturizer on top of it, but giving it some time to dry. Brush your teeth, PJs, whatever that might be. but using that RECU at night. And then in the morning, after you wash your face, let it dry, doing that approach with the plated intense serum. So again, plated, it's the gold container, but the plated intense serum. And so as she described just earlier and what you were just hearing, she talks about the science behind each of the different products, and it's because of the impact that the RECU has and the effect of basically when we're using the product like RECU, it is helping our cells become more responsive and more receptive to the other treatments that we're also going to use. So that's why she is looking at, let's use RECU at night. Let's use plated in the morning. Each of those go onto a clean, dry face first thing. Let each of them dry as fully as you've got time for, and then put your next products on top of that. So again, instead of using both products twice a day, you're getting the biggest bang and the most effectiveness and the biggest impact by isolating these products and not kind of running the risk of maybe one diluting the other. But then also, again, you're getting the full impact and you're using half the product. And so from a pocketbook standpoint, that's beneficial too. All right. So now back to our regular interview with Dr. Lupo. And then a couple of more things on the therapies. What do you tell people who ask you about red light therapy for your skin?
Well, it's interesting. Red light therapy, and I assume you're talking about the at-home products. Right. Okay, so first of all, these products are really safe because they are tested for mass use. And the FDA, the number one thing they're interested in is this safe? The FDA isn't really that concerned about how effective it is, and they really don't have a lot of comparison. And red light works sort of like maybe at a mitochondrial level, like an energizer for your cells, which is good. That's a good thing. I think the key to red light therapy is to temper your expectations and understand that this is a little something that you can do every day that over time I do think helps.
Okay.
But I told a guy, so this couple comes in to see me, a husband and a wife, and they're so cute. They're in their mid-40s, and they're devoted Botox users. And they love it, and they come in together. It's the cutest thing. And apparently the wife has bought them red light therapy. So he asked me, Doc, do I want to use this? And I know him well enough. And I said, look, are you going to use this every day for 6 months? And he says, no. I go, then don't bother.
Right.
Because unless you're willing to use it, because it's like chicken soup, it can't hurt and it probably helps, but the amount that it helps depends on your compliance.
Right. Which is like any of the products that we're talking about too. But when you're
you're going to see more improvement quicker when you use Rion, plated skin science, and when you use RECU. Oh, yeah.
Even more than,
wow. Wow. Definitely more than red light.
Yeah. I just mean the consistency. Like you could buy it, you could use it here and there, but part of it is still consistency.
Right. It's got to be consistency. But I'm saying you see improvement with these type of actives absolutely within 4 weeks. And you don't see that with red light therapy.
That's a lot of effort going into it for not as much a return.
But it's, if you've got this attitude, like it's fun, I want to do this.
And people may find it relaxing too.
Yes. So I'm not going to poo-poo. I don't poo-poo facials.
Yeah, right.
Because facials, going to a spa and getting a facial and getting that treatment that super hydrates your skin and relaxes you, I think that's wonderful.
Right.
I just think you have to have realistic expectations about what it is you're paying for.
And it doesn't take the place of the other therapeutic approaches.
Exactly.
What about PRP advances and using that for biostimulation?
So one of the things that I've been doing with PRP, because like I said, the problem with PRP is you never know any day and time what your platelets are doing. So in order to make sure I'm doing something for my patients, I'm doing the treatment where it thickens the PRP. And there are treatments like platelet-rich fibrin or derma PRP where you thicken it by, in the case of derma PRP, when you heat it, the heat uncoils the albumin and it thickens it. So you're actually getting a little bit of a filler that has space occupying while you're biostimulating. So the better question is, who do I use Derma PRP on? People who absolutely don't want to use anything foreign in their bodies for whatever reason, their personality or their sensibilities will allow. They don't go, I don't want to put anything, even though hyaluronic acid is in your body naturally, this is a synthetic hyaluronic acid. Polyalactic acid or Sculptra, just so people know, it's the exact same thing that's in sutures that are buried underneath your skin when you have a deep wound, and they have to tie that together to hold the skin deeper together so there's no dead space, and the body gradually over time replaces that. It was really pretty ingenious how they came up with Sculptra, because you're taking PLLA and it's in a powder and you're putting it sort of all over, and you're stimulating that response of collagen stimulation to replace the skin. And it's just done in a microscopic way. Wasn't that clever?
It's like magic. Yeah. Really
it's clever.
Really clever. Yes. So with the PRP, you're pulling someone's platelets.
You draw their blood and then you spin it to separate the platelets, and then the platelet-rich plasma. In other words, you get rid of the red blood cells, that sort of thing, because that part can be somewhat inflammatory, and obviously it would bruise, give people the hue of a bruise, because blood has the pigment in it that gives the bruise the color. So it's the clear part, and with Derma PRP, you heat it, and it uncoils the protein. And depending on how long we heat it, depends on how thick it gets. And so we're injecting that.
Wow. And is it in the same day, or does someone?
No, it's all done at the same time.
Yeah.
It's a little time consuming because the patient has to come in, we have to draw their blood, then we have to spin it. So the patient is there for probably a good 30 minutes before I start injecting them.
So if someone is interested in that, it's an approach not unlike filler, but completely of your own body.
Correct.
Like you're not adding something foreign into
exactly.
it.
Because regular PRP is just liquidy. And by the way, PRP is more used for hair stimulation than it is for aging.
Wow. We didn't even talk hair, and we've talked very little about nutrition. But other than that, specific nutrition, but let's just hit the high spots. Sugar has, just say it really quickly because it's the advanced
glycation end products.
I love it because it's age. Advanced glycation end products. Sugar increases this.
Correct.
And so when we look at if you need one more reason to cut added sugar from your diet, it's skin, because that creates the wrinkles, fine lines.
Correct.
And then alcohol, effect on our skin.
Yes. So alcohol, I'm not an anti-alcohol person. I don't think you can be. I drink very modestly, but I don't think you can be a true New Orleanian and be totally negative
These
on
days,
alcohol.
there's some, yeah.
There's a few. But to me, drinking and eating is a joyful thing. And you should never drink alone, and you should never drink when you're depressed or unhappy, because it's a depressant. So it should be in the context of a festive, celebratory thing,
I had somebody tell me they drink for other people.
Yes,
when they drink,
yes.
Right.
So, I don't drink during the week, number one. I just think that I don't feel quite as sharp the next morning. And I am a big believer that if at all possible, go with red wine, because the resveratrol is there, and that's a very good thing.
What about the impact of it on skin, though? What do you see for someone who's
if you
a heavy
drink
drinker?
too much,
yeah, that's what I'm looking at.
You get a lot of telangiectasia, which is broken capillaries, but the broken capillaries are even more impacted by smoking.
Okay.
Because when you smoke, you are suffocating your skin. Your skin is really suffers from smoking. And the nicotine is vasoconstrictive, which is why smoking is so bad for your heart, because the vasoconstriction stresses your heart, and the vasoconstriction deprives your skin of oxygen. And in the context of that, your body doesn't like to lose that, so it actually causes little capillaries to to enlarge in response to this suffocation,
Right.
and you get a ruddiness to your skin, and you get visible broken capillaries. Now, you
From
can
both
also
smoking and
you can
from
also
alcohol.
get that from rosacea, but
Right.
drinking definitely causes it. So,
with
and
the
smoking.
alcohol free for 40, which as this airs, that we might be in the middle of. I'm not sure exactly what the timing will be on that, but it's 40 days without alcohol, and we do people's labs and we do their physical markers, but we do this close up photo, like real close before and after
For their skin.
for their skin. And what we see, the under eye circles, the puffiness, the inflammation, the redness, and then also a lot of times their eyes, the clarity of the whites of their eyes. And people sometimes are taken aback, like because so if someone as our listeners have gone to see Dr. Lupo, you know that at times Dr. Lupo gets on our faces with the camera real close, and you get it. We're like that, but it's not a vanity thing. It lets us see. And some people it's a modest effect, but some just from giving up alcohol. One looks like the guy who was like on the sign at the post office. His after looks like someone I want to set my friend up with.
So a lot of that is also going to be because when you drink, you tend to sleep more on your side. You tend to snore more. You don't
And you
sleep as
poorly,
well.
right?
And I think that's what causes the periocular problem.
Yeah.
And I'm telling you, I tell people all the time, drink more water, drink less alcohol. If they're concerned about puffy eyes, there is something to alcohol and puffy eyes.
The last two things, hydration, we've talked about that through, but hydration in your body that we're consuming, but also hydration on our skin. Fats, not going with a low-fat diet. Our body needs fats for our skin. And so I think people have kind of pulled themselves out of the 80s and 90s of the low-fat craze, but making sure you're adding in this plant-based fats, the omega-3s, that you're having
avocados. So you know what's also important? Remember this. Remember that a calorie from fat it's gonna satiate you more than that same calorie
from
carb or protein. So there is something to be said about putting the fat in there so that you feel more satisfied.
The difference that people can have for carb cravings when they're getting enough fats in their diet, they don't have the carb cravings, the sugar cravings.
Exactly.
The last one is collagen. Do you use collagen supplement?
So I do amino acid, okay. So, I tell people, look, you can do a steak. A steak is broken down into amino acids. The collagen doesn't get into your bloodstream. The collagen is broken down into amino acids. So how do you want to get your protein?
Right. So it's a fine source of protein.
It's fine. So get that source of protein with something that tastes good. Eat a steak, eat the fish, and I'm a person, I love legumes. I love beans, and I'll eat peanuts and, that sort of thing. I don't like peanut butter at all, but I really like peanuts.
But for the person who's maybe using a protein powder anyway, or collagen, because it can be dissolved well and doesn't really have a flavor in their coffee or in things that they're not going to notice it. Right.
That's fine.
But you're not looking at supplement with collagen. There's not going to be that direct link between collagen we consume and the collagen in our cheeks.
Correct.
Yeah.
So the only thing that has been studied again is they seem to think that there's data that if you're having these amino acids, because it's amino acids. Some people call it peptides, some people call it something else, but at the end of the day, it's all broken down to the amino acids that are the building blocks of your muscles, of your skin, of your bones, of your hair, et cetera, et cetera, et cetera. So you need the protein. How you get it is your choice.
Right. Totally your choice. Summing it up, one last big takeaway, if we haven't covered it for our listeners, or just sort of your philosophy on what to put our focus on, our attention on, as for skincare in general and on aging well.
So I think aging well in general is do not be so hard on yourself, but do everything that you can do to take your health into your own hands. Watch what you eat. Now, I'm not saying don't eat bad. I love bacon. I'm not giving up bacon under any circumstances. Do I have an occasional king cake? Yes, absolutely. But I am always doing the good things. And that, I think, is a balance in life. I think it's important to get joy from the little things that are good for you. Like learn how to enjoy exercise. Find an exercise that you get pleasure from, and then you'll be more compliant. So do the things with your family and your friends that bring you joy. When you screw up, forgive yourself and move on. Don't beat yourself up. I'm a big believer in looking forward and not I tell people, just give yourself some grace, give yourself some forgiveness, and just move on. And that's when you do something stupid logistically with your family, you say something stupid or you do something stupid, just go, hey, I'm sorry, and just try to make it up to them another way.
Or even choices people maybe made for their health, thinking they were doing, or their skin, thinking they were doing the right thing, but
you can just move forward.
Right.
And then if in regards to aging with the things like skincare, I love, sunscreens are important. Find a routine that gives you the results. Because like I said, that lady who came in, who was on the peptide and Epicurious, and she said, I'm happy when I look in the mirror now. That made my day. That's what I want. So you want to look in the mirror and you want to feel like you've got a glow, that your skin looks hydrated, not dehydrated and shriveled and wrinkled and saggy. And don't wait until you're 55 to do something. The earlier you start, the less aggressive we have to be. I mean, so I'm going to be 72 and I haven't had a facelift. But I've been doing stuff to myself for, I don't know, 30 years now? Maybe more than that, 40. I started early on in my late 20s, early 30s. I did start with retinoic acid and lactic acid to exfoliate and use sunscreen. Mm-hmm. And that was all that we had back then. And then light chemical peels, the old chemical peels and stuff. So start early, and it's like if you do something about that first 5 pounds, then you don't have 15.
Right.
So be aware of where your health is going. I'm not a big believer in weighing yourself every day, but see how your clothes are fitting, and maybe weigh yourself every couple of weeks and see if there's a trend upward, and maybe you want to go, maybe I need to cut back on just a little something. Well, it's just 2 or 3 pounds heavier, and that's a lot easier than having to lose 10, 15, or whatever pounds more.
And the same thing with skincare as you're doing it all along the way versus having this huge monumental lift that we've got to do. And it's also finding people that you can have on your corner who you trust, who give you this providers, whether it's a dermatologist, registered dietitians, you can trust them. They're working with your lifestyle. You can be super open with them, and I think that that's a big thing. Like your patients have so much trust for you. Our lifestyle nutrition team, like our clients have so much trust for the dietitians. We have to be open, and we have to find someone that we click with. Mm-hmm. And so as you're listening, like find someone that you can trust. And when we're talking skincare, find that dermatologist that you trust. Find things that you may say, this one product, like we said, is pricey, but how much are you spending on all the littles that are just sitting in a drawer that you're not even using because you thought it was going to be that miracle lotion or potion? And so finding someone who can help you streamline your system, do what's going to work best for you, help you still be you. They're not changing what you look like there. And they're listening to you, and they're taking it in a way that feels safe and kind of the pace that you're looking at. So I think, all of those are things that I think that you give to your patients. And so if someone is fortunate enough to see Dr. Lupo as their patient, if not, find someone who is that way,
I think it's very important. Look at your doctor. If your doctor looks weird or strange, I think the human person is very good at reading truthfulness. I really do. I really think when someone tells you something that's true, you know it. And it's hard to say, how do I know that? It's the same thing where they tell you in safety courses, if your hair is standing on end and you feel unsafe, listen to your body, listen to your instinct.
And if you have that trust, listen to that. And I think if someone does have a provider that you don't feel is listening to you, and I think about this from the nutrition perspective, sometimes if they're taking certain supplements, they don't want to say it because they may be shamed by the provider or kind of dismissed. And so if you're feeling that way and you feel like they're either not listening to you or they're kind of dismissing, then maybe it's find another provider who you can be truly open with, and you feel that you can be, because you need to lay everything out on the table. Like we said earlier, if you're taking one of the GLP-1 medications and you're coming in to get something done about that Ozempic face, your provider needs to know that you've been taking it because it's going to affect the treatment.
I do strongly believe that. Yeah. People ask, because being at my age and, social media, it doesn't come naturally to us. And so people go, well, are you on social media? I go, let me tell you the reasons I'm on social media, specifically Instagram. Number one, if the real authorities and experts and the people who have the training and the runtime of experience aren't on social media, the void will be replaced by posers and people who do not have the training, do not have the expertise. That's number one. And number two, I think social media with doctors gives you a little glimpse into the doctor's personality and what kind of, and so you can decide, I would like to, I know this sounds corny, but, I'd like to have lunch with that person and chat with that person. I think that would be, and I hate to use the word fun because that diminishes the importance of the medical visit, but I think.
But it can be fun.
I think it should be fun.
Yeah.
I think helping people look better should be a journey that is serious but joyful, and from joy usually comes fun.
So for people, finding things that bring them joy that also are good for them.
Yes.
Movement, foods that they're eating, the skincare routine that's doable, the skincare routine that not only works within their time allocation, but also works within their budget. And finding these things that, they're putting the focus into what matters and letting go of the stuff that doesn't.
Yep. If it doesn't feel good, just get rid of it.
Thank you so much for your time. I love this. I learn so much from you all the time, and to share this with our listeners, I'm really grateful.
Well, I'm so glad to be here with you, and I hope it was productive.
So productive, so much incredible information here, and I am so grateful for Dr. Lupo's time and really just how clearly she cuts through the noise from products and routines to hormones, injectables, devices, just really helping us to understand it, make sense of it, and in some cases, maybe land on what's best for us, and in others, help us even identify what questions to bring to our own providers. And as I've mentioned, I'll include the links in the show notes to the resources or past podcasts that we talked about, including Dr. Lupo's Instagram, and then also some of the products and categories and stuff we talked about today. And let me know what you think. If you are working towards simplifying your routine or changing how you layer your hydration, or you're booking a conversation with your physician, your provider to talk about all of this, I'd love to hear how it goes, what changes and what you're seeing hopefully improve. And let me know what you think. If you are working to streamline your routine or change up things to kind of match where you are or where you are in the stage of life, kind of freshen up your systems, your routine, and or, new things that you've learned to bring to your providers. Let me know how it goes. I always want to hear about it. I am registered dietitian Molly Kimball, and you've been listening to Fueled Wellness and Nutrition, the podcast. And if you'd like more Fueled Wellness and Nutrition, head over to mollykimball.com, and you can follow me, Molly Kimball RD, on Instagram, Facebook, and Twitter. If you haven't yet, please go to Apple Podcasts and subscribe, rate, and review this podcast. Join us next time for another dose of Fueled Wellness and Nutrition. Thanks for listening, and stay focused on living your strongest, healthiest life.